So hello students, our today's question is on dental materials. So let us discuss them. The first question, an elastic impression material was poured a, uh, using a dental stone. So after some time, the poured model found slightly hot to touch. So one of the following statement is true for this situation. So your answer here will be heat is evolved during the setting of the dental stone. So it is quite usual because heat is evolved during setting of the dental stone. So it is quite usual for a poured dental stone to feel slightly hot on touching, because the heat it is evolved during the setting of dental stone. So dental stone, when mixed with water, it undergoes a chemical reaction that is known as hydration. So this reaction would generate heat as the dental stone hardens and sets. So therefore, a slight warmth or heat when touching a recently poured dental stone model, it is a normal occurrence and it is not a cause for the concern. So dental stone, when mixed with water, it undergoes a chemical reaction that is hydration. So this hydration reaction is exothermic, meaning it releases heat. So the heat generated during the setting of dental stone is due to the exothermic chemical reaction rather than the water to powder ratio, that is the option B. So while the water to powder ratio, it can affect the consistency and the working time of the dental stone, it does not directly cause the heat generated during setting. Third option, the cast pouring should have been delayed. This statement, it is not necessarily true. The heat generated during the setting of dental stone, it is a normal part of setting process. Delaying the pouring of cast would not prevent this heat from being generated. So it is more related to the chemical properties of dental stone itself. So your answer would be A. Moving to the another question, a patient approached the clinic with fallen recent composite restoration. So the pulp, it was protected with zinc oxide eugenol cement. So what could be the reason for failure of composite? The answer is D. Eugenol relieved from the zinc oxide would prevent the polymerization of the composite resin. So when composite restoration fails after being placed over a zinc oxide eugenol cement, it is due to the eugenol component that is interfering with the composite resin. So eugenol that is present in the zinc oxide eugenol cement, it can inhibit the polymerization. So it can do is, it will inhibit the polymerization. So that can result in a weak bond between the composite and the tooth surface. That could cause restoration failure. Option A, the composite materials, they are generally designed to have a good strength for restorative purposes. So option A is incorrect. Composite selection can play a role, but it's more about its compatibility of the composite with specific clinical situation rather a general issue with the composite material. The strength of the zinc oxide eugenol cement is not a major factor in the failure of composite restoration. So it is the interaction between the eugenol and composite polymerization that is more likely to be the issue. So the eugenol relieved from the zinc oxide eugenol would that prevented the polymerization of composite resin. So that would be your answer of choice. A patient came to outpatient department for ortho treatment. Initially, during the impression procedure, the alginate impression got distorted due to the patient gagging. However, later, the dentist managed to make a good impression. How? Excessive alginate, it is loaded on the posterior portion of the tray and this region is seated last. So your answer would be less alginate is loaded to the posterior and it was seated first. So gagging, remember gagging sensation. Suppose this one is a tray and more of the composite, more of the alginate is placed posteriorly. So that would lead to gagging. That is triggered by the stimulation of the vagus nerve. So use of the less alginate loaded to the posterior portion and setting it first, it is the common technique to minimize the gag reflex during an alginate impression procedure. So that is why a less alginate it is loaded to the posterior part and it was seated first is your option of choice. An additional silicone was poured by high strength stone in the dental laboratory. However, the cast could not reproduce all the fine details of cavity preparation. What might be the reason? Well, the reason of the cast could not reproduce all the fine details of cavity preparation may be that a hydrophobic impression material could be used. That is addition silicone, a silicone. So hydrophobic impression material will have a difficulty in capturing the fine details in moist or wet environment. So that can result in less accurate reproduction of the prepared tooth surface. In contrast, the hydrophilic impression, they are designed to have a better moisture control and they can reproduce all the fine details more effectively in a wet environment like the mouth. So your answer would be C. Hydrophobic means it will repel water. Hydrophilic means loving water. Next question. If we mix gypsum in a boiling water, what will happen? So, if we mix gypsum in a boiling water, so the reaction would not occur. So when gypsum is mixed with the boiling water, it does not undergo normal setting reaction. Instead, excess heat denaturates the gypsum, preventing it from setting properly. So as a result, the reaction would not occur. And you won't get the desired hardened gypsum. So that is essential to use water at appropriate temperature for mixing the gypsum material to ensure proper setting and getting proper strength. Moving to next question, the cement used as reference material to judge the potential of other materials to elicit a biological response. It is silicate cement. Silicate cement, particularly the calcium silicate based cement like MTA. So they are often used as reference material to assess the biocompatibility and biological response of other material. So they are excellent, they are known for their excellent biocompatibility, and they are used as a standard for evaluating the potential of other dental material to elect a biological response. So answer will be silicate. Moving to next question. Entrapped air porosity on the inner surface of casting sometimes is referred as it is back pressure porosity. So this back pressure porosity, what it can do is it can produce a concave depression caused by inability of the air in mold to escape toward the end of investment. So air unable to escape. That could lead to back pressure porosity. So back pressure porosity refer to the entrapped air porosity on the inner surface of casting that will create a concave depression, and it is caused by inability of the air in mold to escape toward the end of investment. The energy storage property of structure within proportional limit, it is known as a resilience. So the energy stored property of structure within proportional limit, it is resilience. Zinc oxide cement exhibit a faster setting rate when mixed on chilled glass slab that has condensed water on its surface. So the water, it is necessary to initiate the reaction. The reaction So zinc oxide cement, it relies on the setting mechanism that involves the hydrolysis of zinc oxide and subsequent reaction with the eugenol. So water, it is necessary to initiate this reaction, and it proceed more rapidly in a humid environment. So additionally, the presence of zinc acetate dihydrate, it can accelerate the setting reaction by supplying the zinc ions more rapidly. So therefore, when zinc oxide cement, it is mixed on chilled glass slab with condensed water on its surface, it provides a faster setting rate. So remember, when the zinc oxide, the zinc oxide, it will react with water to form zinc hydroxide. So zinc hydroxide, it will react with eugenol to form zinc eugenolate. plus water. So the set structure consists of particles of zinc oxide embedded in matrix of the zinc eugenolate. Moving to next question, when taking impression, the next step after seating the patient and placing the patient napkin is to prior to taking the impression, the patient must be informed of the procedure and process explained so that there is complete cooperation. So next step after sitting the patient and placing the patient napkin when taking impression is to explain the procedure to the patient. It is essential to ensure that the patient understands the process and it is comfortable before proceeding with the impression. So that helps in achieving cooperation and successful impression procedure. Moving to the next question, sublimation. Sublimation, it is a process of converting solid directly into the gas without passing through liquid phase. So there is no liquid phase. The solid is converted directly into the gas. Moving to the next question, what is the most accepted theory for setting of gypsum? The most accepted theory is dissolution precipitation theory. Three theories are there, remember, dissolution precipitation theory, hydration theory and colloidal theory. But the most widely accepted theory is a dissolution precipitation theory. According to this theory, the setting of gypsum products like plaster and stone, it occurs through the series of dissolution and precipitation reaction. Initially, the gypsum it is mixed with water that leads to dissolution of gypsum particles. As the gypsum particles it's come in contact with each other, as the dissolved gypsum ion come in contact with each other in the mixing process, they undergo a chemical reaction and they start to precipitate back as gypsum crystal. So these newly formed crystal interlock and harder over time, resulting in setting and hardening of the gypsum material. Other theory are hydration theory, colloidal theory. So the most important and acceptable theory is dissolution precipitation theory. You are taking impression of patient and there is prolonged immersion in hot water or overheating of impression compound that may lead to, the prolonged immersion in hot water or overheating of impression compound it can lead to leaching of some low molecular ingredients like stearic acid. So leaching of stearic acid from compound. So this leaching can make impression compound brittle. So answer is leaching of stearic acid make it more brittle. The next question, the stress strain curve of which of following material show a higher slope? So the material with the higher slope on stress strain curve, it is typically one with the highest stiffness or modulus of elasticity. So in this case, the gold alloys, they have higher slope on the stress strain curve graph, indicating a higher stiffness comparable to other materials listed above like elastomers, ceramic and enamels. So gold alloys, they are known for their relative high Young modulus of elasticity compared to other dental materials. So that makes them stiffer and less deformable under the stress. Moving to next question, as compared to the acrylic composite resin, they have the composite resin, they have increased water absorption. So composite and acrylic. So remember, composite have increased water absorption. So composite resin, they are known to have higher water absorption. Compared to the acrylic materials. So that means they can absorb more water over time, that can lead to changes in their property and affect their performance in oral cavity. So other statements, they are incorrect. Increased polymerization shrinkage. The composite resin, they have lower polymerization shrinkage compared to the traditional acrylic resin. Increased abrasion resistance. Composite have a good abrasion resistance, but it is not a direct comparison with the acrylic, as both material can have varying degree of abrasion resistance. Lower compressive strength. The composite, they typically have higher compressive strength compared to the acrylic materials. So which property of composite it is more affected by the size and number of fillers? So the property of the composite that is most affected by size and number of filler, it is the polymerization shrinkage. So polymerization shrinkage, it refers to the reduction in the volume that occurs during curing or polymerization process of the composite material. So this shrinkage, it is caused by conversion of monomer into polymer network. So that results in dense and compact structure. So the incorporation of fillers, so their size and their distribution, they can significantly influence the overall polymerization shrinkage of composite. So larger fillers, they act as a obstacle to the shrinkage, whereas higher number of fillers, it can create interfaces that will affect the polymerization process. So the polymerization process, which property of the composite is affected by size and number of fillers, is the polymerization shrinkage. A dentine bonding agent has two ends, hydrophilic and hydrophobic end. The hydrophobic end binds to, the hydrophobic end of dentine bonding agent, it binds to the composite. The hydrophobic end would bind to the composite resin. So that interaction helps in creating a strong and durable bond between dentine and composite. So that will enhance the longevity and performance of the restoration. Whereas the hydrophilic end of the dentine bonding agent, it binds to the collagen in the dentine. So that is important for stable and durable bond between restorative material and natural dentine within the tooth. So here the hydrophobic end is asked. So hydrophobic would bind to composite. So answer would be composite resin. And if the question was asked hydrophilic end binds to, then the answer would be collagen in the dentine. So which of following is not an impression material which sets by irreversible reaction? So Impression material which sets by irreversible reaction. These are the irreversible that sets by irreversible, and it is the agar, the hydrocolloid, which is reversible. So your answer would be agar, as it is reversible. Remember the classification of impression materials, elastic and non-elastic. Moving to next question, the shape of indent in Knoop's hardness test. So Knoop hardness test, it employs a diamond shaped tool that is cut in the geometric configuration. The impression, it is a rhomboid in outline, and length of the largest diagonal it is measured. So the load, it is divided by projected area to given Knoop hardness number. A alginate impression was taken of patient with a fixed appliance, and the tearing of impression occurred in critical area as result of severely undercut areas. So choose the incorrect option. So the incorrect is mixes with low powder ratio have higher tear strength. So the tear strength of alginate, it tends to increase with a higher powder liquid ratio, and not the lower one. So a higher powder liquid ratio result in thicker mix, more viscous mix that will have a higher tear strength. So that is because a thicker mix, it is less likely to tear during removal from undercut area, or when or subjected to forces during removal from the mouth. Moving to next question. A mix of alginate was made and setting time was shorter than previously experienced. The material was too stiff at the time of insertion to obtain adequate setting and surface detail. All of following are cause of this problem except. So most common cause for the shortened setting time is too high temperature of mixed water. So using a water that is substantially colder than the recommended temperature for mixing alginate can actually prolong the setting time, not shorten it. So colder water tends to slow down the setting reaction of alginate, leading to colder water. It will slow down the setting time. It will slow down the setting reaction that leads to longer working time. So using the water at lower temperature, it can cause the material to be fluid at time of insertion rather than too stiff. So the other statements correctly identify the cause of shortened setting time for the alginate. The second option is the aging of alginate powder in warm, humid atmosphere. It can affect the setting. The increased amount of powder causes the setting or gelation time to be less than the normal experience. Which of following is known as micro hardness test? Well, noob hardness, it is known as micro hardness. For bonding to be effective, the wetting angle should be minimum with the hard tissue. So remember, for bonding to be effective, it should have minimum wetting angle with the hard tissue. That includes both the enamel and dentine. So wetting angle, it describes how well a liquid spreads on the solid surface. And a smaller wetting angle, so if the wetting angle it is smaller, less than 90 degree, it indicates a better wetting. So it is due to the feature of the surface tension. The surface tension, it is a property of liquid that arises from the cohesive forces between the molecules at the liquid surface. So wetting angle, it is known as the contact angle, that is angle formed by intersection of the liquid surface and the solid surface. So if this angle is is acute or less than 90 degree, then the liquid has solid attraction to the solid surface that encourage it to spread out and wet the surface effectively. So when the wetting angle it is less than 90 degree, the liquid tends to wet the surface, spreading out, making a good contact with it. So when the angle it is greater than 90 degree, so when the angle it is greater than 90 degree, it indicates poor wetting and liquid tends to bead up rather than spread out on the surface. So zero angle means perfect wetting, and contact of angle of 180 means there would be no wetting. So wetting angle should be minimum. The setting time of gypsum, it is measured through Vickett needle. So Vickett needle, it is a laboratory apparatus that is used to determine the setting time of cement, gypsum and other materials. So it consists of a Vickett apparatus that consists of a metal frame with vertical guide rod. It has needles, Vickett needles, comes with various different diameter and shape. So Vickett needle, it is allowed to penetrate the surface of the sample under its weight as the material tends to set. So needle penetration depth, it is measured at regular time intervals. So setting time is determined when the needle no longer make a significant impression or mark on the material surface. So that indicates that material has reached a certain level of hardness and it is no longer in plastic or a flowable state. So image shown in this procedure, it is acid etching it is done. So most common we use is the phosphoric acid. When mixing with water and gypsum, which of following should be added first? Well, the water should be added first, as the gypsum product it can be poured in small quantity. So water should be added first when mixing water and gypsum. Adding water first allow for better control over the mixing process. You can add the gypsum product slowly and gradually while monitoring the consistency of the mixture. So that helps to prevent the lump formation. So other is there is a reduced risk of air entrapment. Adding water first minimize the risk of the trapping air bubbles into the mixture. Or by adding water first, you can also adjust the water to powder liquid ratio more accurately to achieve the desired consistency for specific dental procedure you are performing. Moving to another question, the least irritating of all dental cement is? Well, zinc oxide, it is the least irritating of all the dental cement because it has a pH at the time of placement, its pH is 7. So it is considered to be least irritating of all the cement because it has a neutral pH at the time of placement, that is around 7. Zinc phosphate, it is a commonly used dental cement, but it can be more irritating to dental pulp and surrounding tissue compared to the zinc oxide eugenol. So therefore it is not an option. So your answer of choice would be zinc oxide eugenol cement. So these key facts are very important for your exam point of view. Now, which cement releases fluoride? It's polycarboxylate, GIC, and silicate cement. Which cement bond truly chemically adhesive which cement are truly chemical adhesive to the tooth structure? They are the polycarboxylate and glass ionomer cement. Cement that bonds to both enamel and dentine is GIC. Cement that bonds to enamel but not to dentine is polycarboxylate. Cement with the least thickness is zinc phosphate and its luting thickness 18 microns. Most compatible with the pulp is the zinc oxide eugenol cement. Cement that has obtundant effect is the zinc oxide eugenol. So that's why it's least irritating of all the cement. The cement that is dimensionally more stable, it's zinc oxide eugenol. Least irritating to pulp is zinc oxide eugenol. Most irritating to pulp is silicophosphate, silicates, and zinc phosphate in the order. Least soluble in oral cavity is resin cement. So most soluble cement is silicate, most anti-cariogenic is silicate cement. So remember all these values for your entrance point of view. Many questions have been asked in your entrance regarding this. Moving to the next question, the best way to remove a hydrocolloid impression from the patient's mouth is? So the best method is So the rocking the impression slightly helps to disengage it from any undercuts in the oral cavity. That ensures that impression can be removed smoothly without causing distortion or tearing of the impression material. So gentle rocking minimizes the forces and the discomfort that is experienced by patient during the removal process. The heat required to evaporate the vapor ongoing of water is latent heat of vaporization. So let us discuss. The answer is latent heat of vaporization. What is latent heat of a fusion? So latent heat of fusion means the heat required to change a substance from solid to liquid phase is that is to melt it at its melting point. What is latent heat of vaporization? It is the heat required to change a substance from liquid state to the gaseous state. And sublimation, it is a process where substance is changed from solid directly to the gas state. So heat required to evaporate the vapors ongoing of water is latent heat of vaporization. Increase in the temperature while soldering cobalt chromium will cause, well, the increase in temperature during soldering, it leads to formation of chromium carbide. And allowing precipitation at the grain boundaries that leads in passivation. So when the cobalt chromium alloys they are exposed to excessive temperature during soldering or welding, there will be formation of chromium carbide. So the chromium content in cobalt chromium plays a crucial role in providing corrosion resistance. So chromium will form a passive oxide layer on the surface of alloy that will protect it from corrosion. So when the chromium it is tied up in carbides due to high temperature exposure, it becomes unavailable to form protective oxide layer. So there will be a reduced corrosion resistance. All of the following can be used to slow down the setting of zinc oxide eugenol impression paste, except adding a small amount of glycerin. Glycerin can be added to zinc oxide eugenol to extend the working time and slow down the setting process. Adding a small amount of water can be also added to increase the working time of the zinc oxide eugenol impression paste, delaying the setting. Adding a small amount of wax can be added to slow down its setting time. However, cooling the mixing glass slab is not the method. The cooling the glass slab may have little to no effect on the setting time of material. So cooling the slab can increase the setting time of the zinc oxide eugenol impression paste. So various components of zinc oxide eugenol impression paste you should know. It has a base paste and accelerator paste. The base paste consists of zinc oxide, that is 87%, mineral oils 13%. It has oil of clove, gums, filler, lanolin, balsam, and calcium chloride. So these are the accelerator components of the accelerator paste and the base paste. Using a dentin bonding agent usually involve. While using a dentin bonding agent, the steps number 1 is the tooth preparation, isolating and etching. The third is acid etching. Fourth is a wash with the air water spray. Fifth is drying. Fourth and the last process, sixth process, is application of the primer and dentin bonding agent. So acid etching, drying, application of primer, and then the dentin bonding agent. In composite, 75% filler weight is approximately what percent volume of the filler. So remember the density of the filler material in composite. If you assume that the density of the filler material is relative constant, then the volume percentage of the filler is same as the weight percent. So if 75% weight is the filler, then it is approximately 75% by volume. The pH of fully set zinc phosphate cement is. The pH of fully set zinc phosphate cement is in the range of 5 to 6. So at the time of cementation, the pH is 2 approximate. As the time the acidity reduces, by the end of 24 hours, the pH is 7.5. So it is around 5 to 6. Remember that. So which cement base has highest modulus of elasticity? Remember, the zinc phosphate has highest modulus of elasticity. Which cement has thinnest film thickness? It's zinc phosphate. Which cement is most soluble in oral cavity? It's silicate cement. Most antiochariogenic is silicate. Antichariogenic is silicate. Cement which have thermal expansion close to tooth surface, it's silicate cement. The cement that is bacteriostatic, it's the copper oxide. The cement most irritating to pulp, it's the zinc phosphate cement. So the pulpal irritation is in order of number 1 zinc phosphate, is greater than glass ionomer, then polycarboxylate, and then is zinc oxide eugenol. So remember, zinc oxide eugenol, it is least irritating to pulp, and zinc phosphate is most irritating to the pulp. Impression of dentulous quadrant was taken with medium consistency polyether impression material. The normal relief of 2 mm was provided between the tray and oral structure. After removal, you will see the tearing was noted at several locations. What could be the cause? The relief between the custom tray and the oral structure is typically provided to prevent such tearing. So due to inadequate relief, the impression material can become trapped and tear when the tray is removed from the oral structures. So that can lead to tearing of the impression. The C-silicon reaction is initiated by stannous octet that act as a catalyst. So it will promote the cross-linking of polymer chains and lead to setting and curing. So remember the component of condensation silicon, the base and the catalyst. The base has polydimethyl siloxane, filler and color pigments, and catalyst that the component are orthoethyl silicate and cross-linking agent. Stannous octet is the catalyst. Which of following cement has high solubility in water in weight percentage? So it's the GIC which has highest solubility in the water. The cement that is contraindicated under composite restoration is zinc oxide eugenol. We have discussed this question previously too. Remember that. Benzold-Brooke effect is, so Benzold-Brooke effect refers to phenomenon in which the color of substance it changes due to change in pH or presence of specific ions or molecules. So it is observed in chemical reaction including the dyes and indicator where a change in color indicates a change in chemical environment or the pH level. The liquid whose viscosity decreases with increased strain, it's the pseudoplastic. So remember the first in the pseudoplastic the viscosity it will decrease as the shear rate increases. So that means that the fluid will become thinner and flow more easily when subjected to higher forces. The Newtonian force in which the viscosity it is constant. Straight line, that means it is constant regardless of the shear rate. Dilatant, in dilatant means the viscosity it increases. As the shear rate increases, that means the fluid will become thicker and resist more flow as the shear forces increases. So liquid whose viscosity decreases with increasing strain is the answer is pseudoplastic. The next question, the laminate impression technique utilizes in laminate or agar alginate method, the tray it is filled with chilled alginate. So that bonds with the agar expressed from the syringe. So the agar it will set by chemical reaction and the alginate it will set by the chemical reaction and agar gels by mean of contact with the cool alginate. So the child tray. So in this the custom tray designed to fit the patient arch. So here a custom tray it is designed to fit the patient arch. It is made up of acrylic. So prepare a suitable alginate impression. So alginate is preferred due to its short setting time. Load the mixed alginate into the tray and make sure it is evenly distributed to cover all the teeth and soft tissue that need to be captured. So अगर it is अगर is a reversible hydrocolloid, अगर it is a reversible hydrocolloid that is often used in conjugation with alginate, that is a laminate technique. So it is usually prepared by dissolving agar powder in water and then heating to create a gel-like consistency. So using a syringe, express the warm agar material onto the surface of alginate in the tray. So in the laminate technique, both the alginate and the agar impression are taken simultaneously. So you have to set the tray with the both alginate and agar into the patient mouth. So the tray, it is properly positioned to capture the desired structures. Allow the agar to cool and set that usually occurs relatively quickly. The agar will gel by contact with the cooler alginate material. So once both agar and alginate they have set, you have to remove the tray from the patient's mouth. So that is the laminate technique. So answer is A. The incorrect about hemihydrate and anhydrate form from the gypsum is, well, the process of the heating gypsum for manufacture of the plaster, it is known as calcination. So when heated, the calcium sulfate dihydrate, when heated, calcium sulfate at 110 to 130 degrees Celsius, it gets converted into the calcium sulfate dihydrate, it gets converted into calcium sulfate hemihydrate. So temperature is 110 to 130 degrees Celsius. So when they are again heated from 200 to 1000 temperature, then there is formation of hexagonal anhydrate. So this option is correct, this option is correct. When it is again heated from on further heating from 200 to 1000 temperature, so the hexagonal anhydrate, it gets converted into orthorhombic anhydrate. So at temperature of 130 to 200, orthorhombic anhydrate is formed. This is wrong. It is formed at temperature of 200 to 1000 degrees Celsius. Moving to the next question, shellac and phthiric acid, they are added to impression compound. So shellac, phthiric acid and gattabarchite, they will improve the plasticity and workability. So these compounds will improve the impression compound ability to be easily manipulated and shaped during the impression taking procedure. So that will make it more workable. So these are the ingredient of the impression compound. Remember that for your exam point of view. A technique of transferring two fluids into homogeneous mixture without mechanical stirring, it is static mixing. Extra low and putty form of elastomeric impression materials, they are available they are available extra low and putty forms, they are available with condensation and addition silicone. So your answer is C. Polysulfide, it occurs only in light body and heavy body consistency. The temperature at which there is definite reduction in plasticity of impression compound, it is known as fusion temperature. So fusion temperature is a temperature at which the impression compounds goes from plastic state to more solid state as it cools. So this transition, it is important in the use of impression compound for dental impression. The commonly used coupling agents in conventional composite are the organosilicons, zirconates and titanates. So remember the composition of composite resins, they have resin matrix, fillers and coupling agent. The resin matrix components are bis DMA, tec DMA, urethane with dimethacrylate. The fillers include the colloidal silica, quartz, sometimes barium, zirconium have been added to give radio opacity. Coupling agents can be added. So the coupling agents are titanates and zirconates. If a final impression does not capture everything that is intended, which of following statement is incorrect about realigning the existing impression ideally? So in the context provided, it is emphasized that ideally the final impression should not be realigned for any correction. Instead, it should be repeated. So reason include the need to relieve the pressure on the soft displaceable tissue to avoid tissue compression and ensure the dimensional stability of the final impression. So answer is D. So moving to the next question. The tissue contact of the fluid wax will show, well, the tissue contact of fluid wax would typically show a glossy appearance. So this glossiness is often referred as wet look. So the glossy area, the dull area will show the tissue that were not in contact with. So the impression should be uniform, showing a uniform tissue contact. So the areas which appear dull, they are added with more wax, and procedure it is repeated. So the glossy appearance, it is used for visualizing the adaptation and contour of the wax pattern. So that allows the dental professional to assess the fit and aesthetic of the wax pattern. The shellac and the stearic acid, they are added to impression compound to provide the shellac and stearic acid, they are added to impression compound to provide plasticity and workability. So these are the ingredients of the impression compound that you have to remember. It contains resins, copal resins, carnauba wax, stearic acid and talc. So these compounds, the shellac and stearic acid, they help to improve the handling characteristic of the impression compound. So that makes it more malleable and easy to manipulate during impression taking procedure. So shellac and stearic acid, they are added to impression compound to provide plasticity and workability. Other question, the setting time of amalgam it is best controlled by. Well, the setting time of amalgam it is best controlled by the trituration time. So the setting time it is best controlled by altering the trituration speed or the trituration time. So for a given type of alloy, increasing the trituration time or speed will shorten the working and setting time. The next question, the final setting time the setting time of zinc phosphate it may be retarded by, well, it is retarded by adding there are various factors that can retard the setting of the zinc phosphate: temperature, mixing technique, powder to liquid ratio. So question here is asking about the powder to liquid ratio. So altering the powder to liquid ratio can affect the setting time. A higher powder to liquid ratio, that means adding more powder, can retard the setting time. So increasing the addition of powder to liquid will be the answer here. Other methods are use of cool glass slab. It can lower the temperature, that can slow down the setting time. So lowering the temperature can slow down the setting time of zinc phosphate cement. Mixing too vigorously or quickly can accelerate the setting process. So these are the various factors. If the environment is too dry, it may retard the setting time. If the environment is too high, if the humidity is too high, then it can speed the setting time. Next question, the final setting of type 1 zinc oxide eugenol impression paste should be, well, the type 1 is the hard paste with setting time of 10 minutes, and the type 2 is soft paste within the final setting of 15 minutes. So here type 1 zinc oxide eugenol impression paste is asked. The answer is 10 minutes. The temperature at which there is definite reduction in the plasticity of impression compound during cooling, it is known as fusion temperature. So impression compounds, they are manipulated by heating them in hot water to make them soft and for taking impression. So the fusion temperature represents the point at which they solidify and lose their plasticity. So the temperature at which there is distinct reduction of plasticity of impression compound is the fusion temperature. A very important property for recording interproximal and subgingival areas with impression compound is very important property, remember, is the tear strength. So it is a very important property while recording the interproximal and subgingival areas, as the impression material can be of a really less thickness in this area. So if tear strength is not adequate, the material will tear off. So material will tear off and may remain embedded in this area. So it is very difficult to detect embedded elastomer. So your answer would be tear strength. The time from addition of powder to water until mixing is complete is the it is the mixing time. So mixing time, the terminology is mixing time. So as the bond distance between two atoms decreases, the sequence of bond energy so until the atoms they are far apart, the bond energy remains more or less constant. As the atoms comes closer, due to the forces of attraction, and as the atom becomes closer, the force of attraction and repulsion almost become equal, so the bond energy will decrease. The first it is constant, then it decreases, and after that it rapidly increases as the force of repulsion they become stronger. So as the force of repulsion will become stronger, the bond energy would increase. So the sequence would be first it is a constant, then it decreases, and then it increases. So which of following is not a primary atomic bond? Well, the primary atomic bond, they are classified into three main categories: ionic bond, covalent bond, and metallic bond. And the secondary bonds are the van der Waals forces. So not a primary bond is the hydrogen bond. Ionic, covalent, and metallic bond are the primary bonds. The ionic bond, as we know all, it is formed when there is electron transfer from one to another, that results in positive charge and negative charge ions, which are attracted to each other due to the electrostatic forces. The covalent bond is due to the sharing of electrons, and the metallic bond, it is found in the metals. Remember, the hydrogen bond, it is a secondary bond and not a primary bond. Moving to the next question. The hardness number which does not depend upon the ductility. The hardness number which does not depend upon the ductility is the Knoop's hardness number. So we have various hardness numbers like the Brinell hardness number. Remember, Brinell hardness number, it is known for measuring hardness of metal and metallic objects. The Rockwell hardness number has a wider application. since the Brinell test, it is unsuitable for brittle material as well as the plastic material. The other is the Wicker hardness test. The Wicker hardness test, it is used for Wicker's hardness test is for used for gold alloys. So it is used for casting golds. It is suitable for brittle materials and it is used for measuring the hardness of tooth surface. Other is the Knoop hardness test. Remember the Knoop and Wicker, they are classified as micro hardness. The Shore and Barkle, they are used for measuring the hardness of rubber and plastics. Next question, the strain that occurs when the material is stressed to its proportional limit is known as modulus of elasticity. So the modulus of elasticity represents the measure of the material stiffness or its ability to return to original shape after deformation when it is subjected within proportional limit. Resilience, it is the ability of the material to absorb energy when deformed elastically and then release that energy upon unloading. So it is measured by the area under the stress portion of it is measured by the area under the elastic portion of the stress strain curve. The flexibility refers to the ability of material to bend or deform without breaking. The toughness, it is the measure of material's ability to absorb energy to the point of fracture, and again it is represented by total area under the entire stress strain curve. Now what are the key features of stress strain graph? So it has a various regions like elastic region, yield point, plastic region and fracture point. So the elastic point, the initial point of stress strain curve, often refers to the elastic region. So there is linear relation between the stress and the strain. So in this region the material will deform elastically, meaning when the stress is removed, the material will return back to its original shape and size without being showing any permanent deformation. So this behavior is characterized by the Hooke's law, so which states that the stress is directly proportional to strain within this region. The other is the yield point. So yield point, it is a critical point on the stress strain curve that makes transition from elastic to plastic deformation. So beyond the yield point, the material will undergo plastic deformation. So this blue region, this yellow region represents the area beyond the yield point. So that means beyond the yield point the material would deform permanently even when the stress is reduced. So yield point, it indicates a maximum stress a material can withstand without permanent deformation. The third is the plastic region. So this yellow region is the plastic zone. So in this region the material will continue to deform and its shape changes without returning to its original form. And last is the fracture point. So the stress strain eventually reaches a point where the material ruptures or fracture. So the fracture point is a point at which material can no longer support the applied load and it breaks. The ultimate tensile strength is the maximum stress the material can withstand before fracturing. Moving to the next question. The time dependent plastic deformation of material is creep. Creep is the time dependent plastic deformation of the material. So it is a phenomenon where the material deforms slowly and permanently over time when subjected to constant load or stress, especially at elevated temperature or near its melting point. Other options: viscosity, it is a property related to material resistance to flow. It is seen typically in fluids. The flow refers to the deformation or movement of the material. Elasticity is ability to return to its original shape after deformation when the applied load is removed. Moving to next question. The resistance of a liquid to motion is known as viscosity. So viscosity is the fluid internal friction or resistance to flow. So that depends how easily a fluid can be deformed or how resistance it is to motion when subject to an external force. The creep we discussed earlier, that it is time dependent plastic deformation of the material. Diffusion, it refers to movement of particles from higher concentration to area of low concentration. The springiness, it is the ability of material like a spring to return to its original shape after deformation. So your answer is it is viscosity. The setting time of above material, it is the material shown is MTA and its setting time is 2 hours 45 minutes. The stearic acid in the impression compound, this question has been discussed before too. The stearic acid, when added to impression compound, it acts as a plasticizer and it helps to reduce the brittleness rather than increasing it. So answer is B. The low thermal conductivity of impression compound the low thermal conductivity of impression compound is overcome by it is by placing in boiling water at 50 degrees Celsius followed by kneading. So impression compound, we know it has a low thermal conductivity. The impression compound, it has a low thermal conductivity. So that means that they are a poor conductor. So what is that its significance? So during the softening of material, you will see the outside of impression compound will soften first and inside would soften last. So to ensure a uniform softening of material, it should be immersed for sufficient time in the water bath, and a kneading is done that will ensure further uniform softening. So due to the poor thermal conductivity, impression compound does not due to lower poor conductivity, that means that impression compound does not transfer heat very well. So when you heat it, the outer part will get soft first while the inside part will remain cooler. So this is helpful because it allows for even softening. So kneading the compound will make it soft all the way through. So when you cool it, the outer will cool first, while the inside the outer will cool faster than the inside. So waiting for it to cool down completely prevents it from getting distorted. So due to the poor conductivity, the layer adjacent to the mouth will remain soft. So it is important to cool the compound thoroughly. So removal of the impression at this stage, they can cause distortion. Other is the coefficient of thermal expansion. So this property of impression compound, it is attributed to presence of resins and waxes in its composition. So this property is important because it allows the material to expand when heated and contract when cooled. So that is the technique like passing of impression over a flame or spraying cold water on the metal tray helps to reduce the thermal distortion and minimizing the overall contraction. So the low thermal conductivity, it is overcome by placing boiling water at 50 degrees Celsius followed by kneading. Next question, the clogging of abrasive wheel with the debris causing reduction of abrasive action, it is known as blinding. So blinding, it refers to clogging of abrasive wheel with the debris during its use. So when the abrasive wheel, it becomes clogged with the material, it has removed from surface being worked on. So that makes it less effective. Other option is buffing. Buffing, it is a process of smoothing or polishing a surface using a wheel covered with a fine abrasive material. So that is done to create a smooth and shiny surfaces. The third is the dressing. So dressing involves shaping and cleaning of abrasive wheel to maintain its proper size, shape, and effectiveness. So that involves the removal of clogged debris from the surface of abrasive wheel. So dressing is done to ensure that abrasive wheel remain in good working condition. The last option is truing. Truing is procedure like a procedure in which abrasive instrument it is adjusted or reshaped that it rotates without wobbling when placed on workpiece. So it is done to make sure that abrasive tool it is properly aligned and balanced for precise and effective grinding. So the clogging of abrasive wheel with the debris causing reduction of abrasive action is blinding. So after the dentist has completed an etching process on class 3 cavity composite preparation, the preparation gets contaminated with the saliva. So in order, dentist should So the answer is D. So the saliva contamination of each enamel results in precipitation of salivary glycoproteins. So that can prevent the sealant polymers from bonding to the enamel. Re-drying the contaminated surfaces will not remove the precipitated salivary protein, even though the surface will have an etched appearance. So the contaminated surface must be re-etched to remove the precipitate and recondition the enamel for effective bonding. So one precaution to take while repairing old composite is it should not be over dried. Over drying the tooth surface can negatively affect the bonding process. So most bonding agents work best when the tooth is slightly moist. If the dentine it is over dried, it is advisable to rehydrate for short duration before applying the bonding agent. Which of following cement should not be used in mouth breathers? It's the silicate cement. They are contraindicated in mouth breathers. So the silicate cement, they are subjected to dehydration. So when exposed to air, they rapidly lose water and surface will become chalky and craved. So they are contraindicated in mouth breathers. Rather, the silicate cement should be protected from air by coat of varnish, etc. How dry should be the enamel after etching and before placement of bonding resin? It should be almost dry. The enamel should be absolutely dry after etching and before the placement of bonding resin. The hysteresis, it is the temperature lag between the gelation and liquefaction. So the transition from gel to sol state it occur at a different temperature compared to transition from sol to gel. So answer is B. The cement that used extensively for direct attachment of orthodontic bracket, it's the resin cement. The retarder in alginate, it is sodium phosphate. So sodium phosphate in the alginate, it acts as a retarder. It reacts with the calcium sulfate, thereby retard the setting of impression. So remember the various composition of alginate hydrocolloid. It contains soluble or potassium uh, alginate, calcium sulfate, that is the reactor, zinc oxide act as a filler, potassium titanium fluoride, it act as a accelerator, and diatomaceous earth, it act as a filler. The setting expansion of gypsum can be reduced by adding potassium sulfate. So what are the factors that decrease the setting expansion? Reduced speculation, more water powder ratio, adding of more modifiers like NaCl, borax. They are the factors that causes decrease in setting expansion. The use of quartz in gypsum bonding investment is to counteract the expansion. So which of following is the safest and most reliable method of regulating setting time of gypsum product? It's the controlling the temperature of the water to be used for mixing. So the altering water powder ratio beyond a certain limit that can cause decrease in strength and porosity. Options C and D, they have negligible effect on setting time. The best choice is B. Higher the temperature, faster will be the setting. So due to the phenomenon of abfraction, material of choice for restoration in class 5 cavity is resin microfield composite. So the abfraction formation, it is presently believed to be caused by lateral forces on teeth. So the material of choice is microfield composite. So it is the choice due to its ability of flexibility, aesthetics, bonding strength, and ease of use. If the wax pattern has been stored in refrigerator before the investment procedure, the wax pattern should be allowed to return to room temperature if it has been stored in refrigerator. So which of following is not a purpose of using primer to condition the dentine surface? So answer is none of above. So the use of primary in dental procedure that includes increased bone strength, enhancing the wetting ability, reducing the post-operative sensitivity, and creating a to remove the smear layer. And creating a hybrid layer. So none of the provided options accurately represents the purpose of using primer. Ormosers are organic modified ceramic. Which of following component is added in composite to provide opacity? It's titanium dioxide. To increase the opacity, the manufacturer add titanium dioxide and aluminum oxide. Primers are usually hydrophilic in nature. So this hydrophilic nature allow them to adhere to the moist dentin, ensuring a proper bonding with the dental materials. The scratch resistance of material it is measured by Mohs hardness test. So Mohs hardness scale ranks the scratch resistance of material compared to range. So Mohs hardness scale it ranks the scratch resistance of the material. The monophasic elastomeric impression they are based on regular body. So monophase elastomeric are based on the regular body viscosity. These materials are designed to capture the fine details and record the bulk of oral structure. The dental wax pattern should be invested as soon as in order to minimize the change in dimension caused by relaxation of the internal stresses. So dental wax pattern should be invested as soon as possible to minimize the changes in dimension caused by relaxation of internal stress. So these stress can lead to distortion. Warpage in inlay wax it can be minimized by using a warm instrument for carving. So warpage and distortion can occur due to release of stress incorporated during manipulation of wax, and using a warm instrument helps to reduce this tendency. Potato starch it is contained in which impression material? It is contained in impression plaster. So while removing the impression from the cast, the impression and cast they are placed in water, and the heated starch it swells and impression material get disintegrated. Torsional force is a shear force. So torsional force is a type of force that involves the shear stress. So torsional force it refers to twisting or rotational movement. It refers to the twisting or rotational force applied to an object resulting in shear effect. Difference between gelation and liquefaction is the hysteresis. The organic component of the composite contains the organic matrix of composite resin contains bis GMA. The fluoride in GIC leaches out and it is replaced by hydroxyl. Which cement is most kind to pulp? It's the zinc polycarboxylate cement. In dental material setting time of gypsum, it is measured by Vicat needle method. This question has been already discussed. The impression compound the bond of GIC is stronger with enamel. Which of following is used as filler in composite resin? It's the quartz. The modifiers, they are added in the gypsum product mainly to modify the setting time. The impression compound, they are characterized by all of following except the warps at room temperature. Impression compound, all of following except for being a thermoset material. Impression compound agar waxes, they are thermoplastic material and not a thermoset. Thermosets material set through the chemical reaction, while the thermoplastic material, they become soft and pliable when heated and solidify on cooling.